All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance. And this week, apparently, congressional theater selects headlines over health. Today, we're going to cover a fast moving outbreak roundup, dig into a screening tool giving women more control over their own health, and spend some real time on a Senate hearing that says more about power than about public health. So let's get into it. Now we move into this week's public health headlines. Cyclosporiasis just keeps climbing. Since May 1st, CDC has confirmed more than 1,600 domestic cases, and it's tracking more than 5,100 additional reports that may be part of the same outbreak, with over 400 cases already linked to a common food source. Picture a mid-sized concert venue, every single seat filled with someone doubled over from a parasite that hitched a ride through our food supply chain. That's not a freak accident. It's what happens when food safety oversight moves slower than the food itself. Measles has already beaten last year's total, with more than 2,300 confirmed cases across 45 states as of late July. That's an entire small college campus, every single student catching a disease that we had a safe, effective vaccine for since 1963. This isn't a mysterious resurgence. It's the predictable result of a vaccination rate slipping below the threshold that keeps communities protected. West Nile virus is also spreading through Europe, with 81 locally acquired cases across 6 countries as of late July, most concentrated in Italy and Greece. Call it a full orchestra's worth of people infected by mosquitoes that thrive whenever vector control funding gets quietly cut year after year. Mosquitoes don't read budget reports, but they definitely benefit from them. And in the DRC, the Democratic Republic of the Congo, Ebola is now the fastest growing outbreak on record, with 3,442 cases, 1,521 deaths. And I can't even believe I'm about to say this, with a case fatality rate near 44%. Actually, I can believe it because that is Ebola, but holy smokes, we have a near 50% case fatality rate in the DRC. 11 weeks in, case counts are already 7 times higher than that at the same point of the 2014-2016 West Africa outbreak, which was the largest ever recorded. More than 80% of new cases in the outbreak's epicenter aren't linked to any known patient, which means the virus is spreading faster than contact tracers can follow it. The Africa's CDC director calls it exactly what it is: a very serious outbreak that needs a rethink, not just more of the same response. Outbreaks don't wait politely for budgets, trust, or logistics to catch up. Now we move over to the HPV self-collection story, because this is where good science actually meets real-world access. 2 studies this week found that when women are offered a self-collection swab instead of a only clinical exam, more of them get screened. Shocked. In Singapore, simply offering that option raised screening uptake and caught more high-risk HPV cases in a country where only 43% of women get screened annually against a national goal of 70%. Even more striking, a study out of a U.S. opioid treatment program found that over 90% of women agreed to self-collect a sample in a clinical restroom, a population that typically avoids medical care altogether. And nearly 1 in 5 who tested positive for high-risk strain went on to get follow-up care. Now, giving people a private, low-barrier way to protect themselves, and most of them will take it. This is not technology breakthrough. It's a trust breakthrough, and it's proof that access, not willpower, is usually the real power to prevention. Okay, let's move over to the Fauci hearing, because this is where things got genuinely ugly. Dr. Anthony Fauci, who we know spent 5 decades leading this country's response to HIV, anthrax, Ebola, SARS, and COVID-19, sat for nearly 3 hours this week in front of Senator Rand Paul's Homeland Security Committee. He invoked his Fifth Amendment right more than 100 times after Paul and other Republican members openly floated the idea that his testimony could be used to pursue criminal prosecution. Let's be clear about what this is. This is a man who devoted his entire career to public service, and he was essentially told, testify honestly so we can hunt for a technicality to charge you with something. That's not oversight. That's a trap dressed as accountability, and any competent lawyer would have told him to do exactly what he did. Meanwhile, the actual scientific question at the center of it all is the origin of COVID-19. This remains genuinely unresolved with no conclusive evidence either way. But that nuance got buried under the grandstanding, the insults, and the pre-scheduled contempt vote that Paul announced before the hearing even finished. Senator Gary Peters put it plainly, this hearing did real damage instead of teaching real lessons about how to handle the next pandemic. So let's say this directly. Dr. Fauci, whatever anyone's opinion is of those pandemic years, thank you. Thank you for showing up despite the ambush and for a career spent trying to keep people alive while others tried to keep score. And here's the thread connecting all these stories. An outbreak outrunning its response in Congo, a food safety system too slow to catch cyclospore before it spreads across state lines, a measles surge fueled by vaccine hesitancy and eroding coverage, and a hearing that punished honesty instead of rewarding decades of service. None of those are accidents. They are exactly the things that happen when people holding power choose spectacle, budget cuts, and political convenience over shared protection for everybody else. The people who paid for that choice are rarely the ones making it. It's the family that can't trace which grocery store sold the contaminated produce. It's the unvaccinated toddler sitting next to a measles case in a waiting room. It's the community in Ituri province burying loved ones faster than health workers can respond. The HPV story is the exception that proves the rule. When access is denied, with dignity and privacy in mind, people actually respond and screening rates go up. That's the real difference between policy that protects people and policy that merely performs for the cameras. This is Resistance Radio, where natural selection selects resistance, and where the real test this week isn't about whether pathogens adapt, it's whether people writing the rules ever do. Thank you for tuning in. My name is Mark Allandary.